Hi, I'm Cullen Teska of Senior Market Solutions, your Medigap insurance advisors. The sunsetting of Medicare cost plans has been a long anticipated change to the insurance offerings available to Medicare beneficiaries in certain areas of the country. Medicare cost plans are being canceled, with the process spanning 2018 to 2019. As a result, beneficiaries who had or still have a Medicare cost plan have a unique opportunity to course correct during the 2019 Medicare Annual Enrollment Period, or AEP for short. The Medicare AEP started October 15th and runs through December 7th. In this video, I'll provide background on these hybrid plans and present two real-life scenarios to demonstrate the effect of sunsetting on beneficiaries and outline coverage options for affected individuals based on their current situation. Stay tuned, and I'll tell you how to make the most of the 2019 Medicare AEP to find the best Medicare plan that fits your needs and your budget. Medicare cost plans are a type of Medicare health plan operated as an HMO or health maintenance organization. They're offered by private insurance companies, and these companies contract with Medicare to also deliver original Medicare benefits when receiving care outside of the network. Remember, original Medicare is Medicare Parts A and B. Cost plans were originally designed for beneficiaries in rural areas where Medicare Advantage plans, then newly created, were unavailable. A cost plan is a hybrid of a Medicare supplement and a Medicare Advantage plan. Similar to Advantage plans, cost plans have networks, potentially significant out-of-pocket expenses, and low monthly premiums. Like Medicare supplements, cost plans allow beneficiaries to retain their original Medicare coverage for out-of-network healthcare services. For some, Medicare cost plans offer the best of both worlds without having to choose one or the other type of coverage. You might have seen news about Medicare cost plans over the last few years. Their continued availability to beneficiaries was subject to ever-changing legislation. Due to the high expense of administration and relatively low enrollment, the phase-out of cost plans has been decades in the making. While cost plans were being phased out, the number of covered individuals dropped each year. Medicare cost plans will officially sunset in 2019. The largest population of beneficiaries affected by the sunset or cancellation of Medicare cost plans reside in Minnesota. As of 2018, approximately 625,000 people were enrolled in Medicare cost plans nationwide, and 2/3 of them were in Minnesota. The rest are spread across Arizona, California, Colorado, Florida, Iowa, Maryland, North Dakota, Nebraska, New York, South Dakota, Texas, Virginia, and Wisconsin. So how do you know if you're affected by the sunsetting of Medicare cost plans? There's two easy ways. Number one, you received a notice from your insurance company, and it explains what's happening with your cost plan, who's affected, and what you can do next. Number two, you can check your health insurance ID card. If it says Medicare cost plan, or just simply cost, then you're likely affected. For beneficiaries who had or still have a cost plan, the 2019 Medicare AEP is the perfect time to reevaluate your options. If your cost plan was discontinued in 2018, you may or may not have selected a plan that turned out to be dissatisfying. Maybe your healthcare needs have changed, or perhaps you were automatically enrolled into a Medicare Advantage plan by your carrier. For one reason or another, your current coverage doesn't meet your needs. People who enroll in the Medicare Advantage or Medicare cost plan for the first time get a trial right, which lasts up to 12 months. This special enrollment period, or SEP, allows a person to disenroll from the first Advantage plan or cost plan and return to original Medicare. During the trial right, these individuals also benefit from a guaranteed issue clause. As a result, the individual can purchase a Medicare supplement plan without answering health questions or going through medical underwriting. If you're happy with your decision you made in 2018, we applaud you. However, I'd like to remind you to pay close attention to any changes that may have occurred with your chosen plan. I highly encourage you to reevaluate your decision to confirm your 2020 coverage still meets your needs. To help you understand what this looks like in practice, I'll describe a real-life scenario. And I'd like to give a shout out to one of our recent YouTube subscribers whose name we borrowed for this example. So here's scenario number 1. In the fall of 2018, Anna Marie received a notice from her insurance company saying her Medicare cost plan wouldn't offer her coverage in 2019. She needed to choose another option or she'd be automatically enrolled in Medicare Advantage plan recommended by her current carrier. Anna Marie was apprehensive about the cancellation and changes because she didn't fully understand what was happening. Thinking she was picking the safe option, Anna Marie chose to be automatically enrolled in the recommended Advantage plan. Almost a year in, Anna Marie is frustrated with her Advantage plan. She can't see her preferred doctors, and her out-of-pocket expenses are significantly higher than they were on the cost plan. Anna Marie needs to make a change because the Advantage plan isn't meeting her needs. Fortunately, Anna Marie can rely on her trial right. She'll be able to return to original Medicare and select a Medicare supplement plan with no medical underwriting required. With a supplement, Anna Marie will be able to get the care she needs from the doctors and hospitals she prefers. It'll also eliminate most, if not all, of her out-of-pocket expenses. Now that we've talked about beneficiaries who were affected in 2018, let's turn to beneficiaries who will be affected in 2019. For individuals with Medicare cost plans that are sunsetting in 2019, you're probably considering your options for coverage in 2020. Let's talk about another real-life scenario. I'd like to welcome another recent YouTube subscriber whose name we borrowed for the second example. Here's scenario number 2. In the fall of 2019, John received a notice from his insurance company informing him that his Medicare cost plan would be canceled and wouldn't offer him coverage in 2020. While he has several options, John needs to make a decision during the 2019 Medicare Annual Enrollment Period, or AEP. John can allow his insurance company to automatically enroll him in their recommended Medicare Advantage plan or one of his own choosing. Alternatively, John could rejoin original Medicare and purchase a Medicare supplement policy and a prescription drug plan, known as Medicare Part D. So whether you were affected in 2018 or will be affected in 2019, now's the time to review your options for Medicare insurance coverage in 2020. And the best way to start this process is to identify what you liked about your Medicare cost plan. So ask yourself these 4 questions. Number 1, do I like to choose my own doctors without needing a referral? And number 2, would I like the option to decide which out-of-pocket expenses I want to pay? Number 3, do I travel frequently and or need flexibility in selecting providers? And number 4, am I on a fixed income and looking to avoid unexpected out-of-pocket expenses? If you answered yes to any of these questions, a Medicare supplement insurance plan might be the best option for you. When you're evaluating your 2020 coverage options, refer back to these 4 questions and your responses to guide your decision making. Generally speaking, Medicare cost plan beneficiaries have 2 options for coverage in 2020. Option 1, return to original Medicare, which is Medicare Parts A and B. Original Medicare covers benefits on a fee-for-service basis and is managed by the federal government. With Option 1, you can add a Medicare supplement policy, also known as a Medigap policy, to help pay your share of out-of-pocket expenses for Medicare-covered services. Beneficiaries will probably need to add a Medicare Part D prescription drug coverage as well. Option number 2, switch to Medicare Advantage, which is Medicare Part C. Medicare Advantage plans are managed by private insurance companies, and they replace your original Medicare altogether. Keep in mind, a Medicare Advantage plan typically comes with a lot of red tape, things like networks, pre-approvals, and out-of-pocket expenses. They also require annual maintenance, so beneficiaries should be prepared to revisit their policies every year to ensure that they have the coverage they need. At Senior Market Solutions, we frequently hear from dissatisfied beneficiaries who discovered the plan they selected didn't cover their providers, didn't cover their drugs, or a combination of the two. The Medicare AEP runs from October 15th through December 7th, so now is the time to review your insurance coverage options. Whatever your situation, the SMS team is here to help you.
At SMS, we work with all of the top companies such as Aetna, Cigna, and Mutual of Omaha, so our customers get the best rates available. Book a free Medigap consultation by calling us toll-free at 1-855-784-9649 or click the link in the description to book your appointment online.